Welcome to What the Mom podcast. You are listening to Doulas Petra
and Jacqueline.
Motherhood can be isolating and hard.
We are two doulas who want to provide a safe place to talk about all things mom,
From pregnancy
to birth,
to postpartum.
to parenting.
Join us as we have real conversations about real life.
Welcome to What the Mom podcast. You're listening to doulas
Petra.
and Jacqueline.
Welcome to another one of our late night podcasts.
I don't even know how to speak, apparently.
That's your turn. That's how usually me.
Yeah, there you go.
Slow, relaxed press, right?
Yeah. Still my favorite episode.
Thanks for joining us today.
Yeah, we're excited to go over some baby positions in labor. And
That's right.
we need a nickname for our doll.
Yeah, we didn't name her. We
have
have a
name
friend.
her. We have a friend. So this doll, I have a friend that I met on a vendor show that I did. She creates these dolls. So I originally found this style of doll through Petra. She was telling me that she saw these with her mom online, but they're like $200 to $300. And I was like,
Yeah.
I don't want to spend that. And so I thought it would be so awesome also for us to be able to demonstrate things, all things to do with labor and pregnancy. And so I talked to her and I was like, hey, would you be able to make one of these? And she said yes. And I got a steal of a deal. So we have not named her yet.
If you have any ideas, let us know maybe.
Yeah. Do you think she's a
Comments.
Martha? I don't know.
I don't know. We'll have to come up with some ideas.
We'll have to come up with Susan, I don't know. Jane, I don't know.
Jessica.
Birthing
Bertha.
Birth.
I don't know. Let us know some ideas.
Let us know some ideas.
It's probably better than ours.
Probably. So this little thing, it has everything. So it has its belly.
Pregnant belly.
She even put like the boobs on it. And then if you go inside, there's like a spot where the C-section would be. And then this little doll comes out and it actually has a placenta. How stinking cute.
Or a vaginal birth.
So
whichever way. This mama ends up having her birth.
Yeah, exactly. And so we thought it'd be so cool to demonstrate how we can do certain positions.
Yeah.
So that's why we decided to do today, because it's the first time I brought her over and Petra got to see her.
That's
so we're really excited to do that. So we're going to show you just different positions and then kind of some things that you can do if you are in these positions. It doesn't necessarily mean you need a C-section. There are ways to change things, but it also depends on your care provider. So obviously we're doulas. We can't give that medical advice, but at the end of the day, you listen to your healthcare provider. But it's also important to advocate for yourself, because they do say a lot of C-sections are they're not needed a lot of the time. A ton of them. I've had friends that say that they could have birthed their babies, but then the doctors just wouldn't. So it really just depends. And midwives, there's different midwives that will deliver and others that won't.
Depending on the position,
depends, right?
Yeah.
So
it's good to be aware of everything and the options that are there.
Yes, just be educated, because you could save yourself from a C-section. And that's what I know a doula that has helped so many moms avoid that by showing them different ways to change positions. So that's why we thought it'd be cool to hop on here and share with you guys how birthing Bertha or whatever
that's what we're going to use today. So if you guys don't like that name, then give us a better idea,
because we're going to refer to her
Birthing Bertha is going to bear it all today.
Yeah, she's coming into the midwife clinic, and we're going to show you. Okay, so
a normal birth.
So you said it's like this. They come out looking like this.
So if the mom was on her back, like a lot of hospitals would do.
Yeah.
Can you show us what the baby will look like?
Okay. So
you don't actually have to put her in.
Yes. But she comes out like this.
For those that are watching with the video, you're going to probably get a lot more out of this episode.
Yeah.
but we'll still try to explain as much as we can for those who are doing audio only.
Oh, exactly.
So the normal position, the baby is coming out
The
head first.
Yeah.
And the face is facing your butt,
Yeah.
the back to your stomach up front.
Yeah. So when you birth on all fours, you can see the baby coming out
the other way.
like that. It's going to look the other way when it's coming out. And so
people, support people in the room are going to see baby's face if you were on all fours.
Yeah.
Or if you were squatting and they were behind.
You're going to see their head come out.
Yeah.
I think that might be my child.
We hear a baby making noise.
Hopefully it's not her that's going to start screaming. But yeah.
So then the next position
is
that we could have
shoulder transverse. That's when they're laying sideways.
Side to side. So the baby would be side to side.
A lot of the times, would you say that's the most difficult position?
This is probably what worries healthcare providers the most.
Yeah.
You literally cannot have a baby come out like this.
Yeah.
Oftentimes babies will turn.
Yeah.
Right before.
Yeah.
But you never know, so then they'll suggest doing something.
Yeah, I've heard that too.
So there are different things you can do to turn a baby, and we'll talk about that after we finish going through all the different positions.
So that would be shoulder to transverse, okay?
It could be facing either side, left or right as well.
Yeah.
But it's literally sideways.
Yeah. So it would be dangerous for them to come out like that. And then we have face to brow,
which looks like a normal birth almost. Except the difference is the face, instead of having like the top of the head come out, it's the actual face. So you see like a nose and a mouth coming out.
So its face,
which can actually, it stretches the baby's head as they're coming out.
Which can be dangerous.
It can be worrisome.
Yeah, totally.
And that makes for a more painful birth if you were going to give birth that way. Because the head cannot...
it's pushing.
Yeah, they have that soft spot where the... what do they call it? The fontanelle.
I think so.
Where the skull can actually like move and overlap over each other, like the sides.
Yeah.
And they can't do that if it's just the face.
Yeah.
Yeah.
So it's, I mean, you could, I think you can still, it depends. It depends on the healthcare provider.
If they'll do that or not.
If they'll do it, some might not, and they might just opt to have a C-section so that the baby is safe. And
I believe midwives still do.
I think they still do. I think it just depends on the midwife and how comfortable they feel, because I know some that will, I've heard, and then others that are just, I don't know, it worries them too much. And yeah, so I guess it all depends on them. And then you have complete breech, where
knees are up.
Yeah. And their head is tucked, kind of. Is that what it is?
Yeah, a little bit.
Yeah, a little bit.
And it's kind of similar to what a normal birth would be, but opposite, upside down.
So you're gonna see feet are gonna come first. Its butt is gonna come, then its feet are gonna come down.
Yeah, you're gonna see its bum, and then its feet are tucked upwards.
Yeah.
Coming with baby and head last.
Yeah. So
there's a few different ways that they could be breech.
Yeah.
So this is the one.
Yeah.
A lot of times if a baby is breech at the end of pregnancy, a healthcare provider will try to get you to try to do different things to turn baby.
Yeah.
A lot of times they will suggest a C-section, I think.
A lot, yeah, a lot of the time.
There may be certain circumstances where they allow you to still birth baby that way, but I think probably most of the time they'd rather not.
I think, I mean, I've heard midwives still deliver breech babies.
It depends who it is.
It depends on who it is. It depends on your healthcare provider. It depends on how comfortable they feel with doing that. And yeah, like if you have a doctor, and I mean, I've had a lot of friends that have just had C-sections because they don't want to do it. So
Mm-hmm.
it just depends. And at the end of the day, we're just doulas, and we can just tell you to listen to your healthcare provider.
Mm-hmm.
We can't give medical advice. So just make yourself aware, just learn the different positions, learn different ways that you can turn the baby so that you don't have to have a C-section.
Mm-hmm.
It's good to just be educated
Mm-hmm.
and just know that, you can look up different ways. And at the end of the day, it is kind of your decision. And you can choose to, if they want to take that chance or whatever.
Mm-hmm.
But yeah, just be educated. It's important.
Yeah.
Then you'll feel
I
better.
think one of the reasons they do worry though is because of it's a higher chance of the umbilical cord being compressed,
Yeah.
which causes other issues, right?
Which can cause, yeah. Yeah.
And then the baby's not able to breathe.
Mm-hmm.
And if they're not able to breathe through the umbilical cord, they're going to take their first breath.
Mm-hmm.
And if they were breech, for example, and maybe their butt or their foot came out, their head's still in there, they can't take a breath yet.
Mm-hmm.
That's going to be very dangerous. And that's the main reason that they worry about it. It
Yeah.
doesn't mean that's always going to happen.
No. Yeah, it's just, you just go with whatever they do, and you can just always make suggestions. But at the end of the day, the most important thing is getting you and baby to be healthy after the birth. So we're doing footling breech now.
Okay, so the footling breech
is just a foot is hanging out. The other one's up in the chest.
Yeah, the first presentation is going to be literally just a foot that you'll see coming out.
Yeah.
Followed by the butt, and then the other foot is going to be up with the hands.
Yeah.
And then the head.
Yeah. Yeah. So there's footling breech, and then there's frank breech, which the legs are all the way up.
Yeah, so instead of bending at the knees, the legs are like straight up by their head.
Yeah.
And this is going to be another bum presentation.
Yeah.
Where they would come bum first.
Yeah.
Their leg, this one probably would be
harder,
I'm guessing. I'm not 100% sure, but I think so. Just thinking of like how much space it takes up.
Yeah.
Because they're not going to have a foot come out at all.
And they could get stuck, would be my...
The feet won't come out until pretty much the head's coming out.
Yeah.
Because they're all the way up.
Yeah.
And then it would come out.
So you could see concern with that too.
Yeah. So those are some different presentations that the baby may have.
Yeah. And then we're just going to talk about, there's ways to turn the baby. It's called ECV. Is that what it is? External
cephalic version.
Yeah. So that's when they put pressure on the abdomen.
So let's do an example of this.
And
we're going to put baby and birthing Bertha here.
I like it. I don't know. I like it a lot.
Maybe it'll work.
Birthing Brenda. No, birthing Bertha. It sounds better.
It does.
It just has a good ring
so
to
right
it.
Now we have baby sideways. So what the doctor would do, I don't know if midwives do this.
I don't know.
I'm not sure. But what I know for sure doctors would do is they would feel where the abdomen is. And they'd feel, okay, so there's a head here on this side. There's a bum here on the other side. And they will apply pressure
to turn it.
It's going to feel uncomfortable.
Apparently it's super uncomfortable. I have a friend who did it.
But they're going to apply pressure
to
push. So they're going to push the head down, push the bum up. They're going to try to help baby squirm and turn position.
Yeah. It's very uncomfortable. So they will give you that option usually before they decide to say, okay, if baby doesn't turn, that's usually when they'll just say a C-section.
Yeah. Now let's see. Did that work?
Yeah, it did.
There's the baby.
There's the baby's head. It's coming. Good job, Bertha.
Wow. Oh, you did awesome, Bertha. So good.
And then you would deliver the placenta.
Exactly.
And that's how it goes. So yeah, I think that I'm not sure if midwives do it, but I know, yes, doctors definitely do. And I had a friend who tried it and she said it was extremely painful and it was not successful. And then she had a C-section. So again, just be educated. If you're educated, you can get ahead of the game. And there's also certain positions we're going to show you that you can do at home that can also cause the baby to turn as well. I currently have a client right now, and she was doing like this thing where she was sitting. She had her legs up on the couch. She was going like this. This is one of
If you're watching, you can see.
This is one of the biggest ones that they say.
So you're kneeling on the couch.
Yeah.
Butt up in the air.
Yeah.
And then you lean forward so that your hands are on the floor. So basically your head is lower and like your butt's up higher.
Yeah. And that's supposed to help. And she did that quite a few times. And then she went to her midwife and they looked. And it looks like the baby is turning and was transverse, was sideways, and then moved. And I guess the head is slowly coming down. She still has 2 weeks. So, but yeah. That's what we're hoping for because, she does not want a C-section. So, that's a way you can do that too. There's also the Webster technique.
Yeah, this is a chiropractic method.
Yeah.
Technically, it's not researched, but there's plenty of people that will tell you that it worked for them. Basically, the chiropractor, some of them are trained in this. And some aren't. So if you're looking for this, you have to ask the chiropractor specifically, are they trained in the Webster technique?
Yeah.
And then what they will do is basically they're moving your hips to allow the uterus to relax and make room for baby to actually move and change positions. That's all they're doing. Because, I mean, there's so much tension and pressure, right? So you get really tight in there. So they're helping relax it.
Yeah.
That's what they're doing.
And I've heard lots of people that have said it's very successful. And that's the thing.
I've heard many success stories
to
with that
not
one too.
have a C-section, I would try everything. I
That
absolutely would.
So the ECV would be the most invasive, I would say, because it would be the most uncomfortable.
That would be my last resort.
Possibly painful. I'm not sure.
That would be my last resort. My friend did say it was horrible.
Webster technique. I've heard people say it's not. It doesn't hurt at all.
No, it doesn't. It's more relaxing.
That one would be probably a better option to try first.
Yeah.
And even before that, there's things that you can do at home. So like the position that you said.
Yeah.
On the couch, leaning forward.
Yeah.
Doing
lots you can
hands and knees. And then you're just rocking forward and back.
Yeah.
Forward and back. So you're helping rock baby a little bit.
Yeah. And that could also move the baby.
Yeah.
Yeah.
You could do a bridge pose.
Yeah.
Or modified bridge pose where you're on your back, you're bending your knees with your feet flat on the floor.
Yeah.
And then you just lift your pelvis up. So an exercise that would be similar would be glute bridges.
Yeah.
People do glute bridges. They lift up
the
pelvis and they put it back down, except you're just lifting it up and you're holding it up for a little while.
Yeah. Yeah.
Some people say you can apply cold, like ice pack or something, to wherever the head is.
I could see that.
Don't hold it there for too long, obviously, but just like a quick, like 30 seconds max, I'd say. Not very long.
Yeah.
And the idea is that the baby feels that coldness and they squirm and they move away. Yeah. So kind of just pay attention and don't, like, maybe the mom does it, not somebody else to the mom, so you can feel you want to be careful of frostbite too. Like, don't make yourself too cold. But some people have said that works. You can try doing lots of squats, bouncing on an exercise ball, doing hip circles on the exercise ball, or the birth ball, I guess they call it.
Those really help.
Walking up and down the stairs.
Like skipping a stair.
Yeah. I did, as my third, I did sideways walking up the stairs, and then I go down. Yeah. And then I do the other direction. Up the stairs, back down.
Yeah. Gets them into a good position.
Mm-hmm. And then if you want to do kind of a combination of a few things, the mile circuit is what a lot of women will do. And this involves a few different things. So it involves 3 different phases of half an hour each. The first half hour, I always get confused on what first and second, but I think the first is getting baby out of the pelvis, kind of.
Mm-hmm.
So you're going to lay on the floor. You want lots of pillows, blankets, whatever you need to be comfortable.
Yeah.
Set a timer for half an hour, and your butt is just up in the air.
Yeah.
And then your head is laying down. And you can even close your eyes, try to rest during that half hour because you have a timer on.
Mm-hmm.
You could listen to some calm music,
Yeah.
listen to an audiobook,
Yeah.
whatever it is you want to do.
Whatever calms you.
Yeah. And the idea is that, first of all, you're relaxing yourself because you want to be relaxed for labor to start.
Yeah.
And then also you're bringing baby kind of up out of the pelvis area if you need them to be moving. Then after that half hour, the second half hour is going to be just some more like total relaxing. So you're going to do side laying. So you're going to lay down with some pillows and go on your left side. Put your knee over the pillow, like that typical safe sleeping position for a pregnant woman.
Mm-hmm.
Half an hour. Literally, my biggest suggestion is just to try to sleep. You're in a sleeping position anyways.
Yeah.
So then when that timer goes off, the last half hour is the movement. This is when you're going to try to get baby to move back into a good position, down towards the pelvis. And then you can either do bouncing on the exercise ball.
Yeah.
You can do walking on stairs.
Yeah.
You can do curb walking.
Yeah.
You could probably even just do like squats.
Mm-hmm.
Some kind of movement that's kind of getting that pelvis is kind of moving back and forth, getting baby in. You do that 2 times. So then the second time around, you're side laying on the other side though. You can look up Miles Circuit online. You'll find all the information on it.
Mm-hmm. Absolutely. And then usually if this doesn't happen to work, then usually it is just a C-section. So yeah, I mean, those are not fun, but at the end of the day, the baby's safe and healthy, and so is mom, so that's what matters. But what we say is just be educated, because you never know.
It's true, yeah.
You just never know if you could help yourself to avoid one. So, yeah.
And if you do happen to have a vaginal delivery still with a not optimal position, your labor will probably be longer.
Yeah.
And then the worry is always going to be the umbilical cord. You don't want it to be compressed and squished.
Yeah.
So if, say maybe if this did happen and you were birthing a baby in, I don't know, say breech position of some kind, the biggest thing is to remember that you need to stay calm. Because, I mean, stuff happens, like maybe you end up having an unplanned unassisted birth. Maybe it just happened so quickly you couldn't get to the hospital. They couldn't get to you fast enough. You know? The biggest thing would be to stay calm.
Yeah.
You don't want to be stressed.
No, that's the worst thing you can do for yourself. Absolutely.
But ideally, we want to be prepared using all of these ideas to try to move baby. And they say around like 97% of babies are in an optimal position before labor begins. Yeah. So most babies are.
And if they're not, then they can switch. You just might have to do a little bit of work to have that happen. Yeah. Yeah. Exactly. Sometimes they will do it on their own too, like last minute. Yeah. Some babies surprise you. Yeah. Which is awesome. Yeah. Yeah. So that's all we got with birthing Bertha. That's right. This is what we got. It's what we're working with. Say goodbye. Oh, she got her baby. She gave birth and she's a happy mother. She sure is. So if you want to have this, make sure you educate yourself. That's and right. Let us know if you have any questions in the comments. Let us know if you have any other names for us. Or if you like it. Maybe this one's going to stick. Maybe it's going to stick. Exactly. Until next time. What the mom?